Hey folks, Doug Blake with Body Design University. In this video, I want to talk to you about chapter 5, or at least the very beginning of chapter 5. This is the pre-participation health screening. Chapter 5 is not the longest chapter, and there are two components to this because I'm asked, fairly often about screening tools and testing and those other elements associated with the very start of an exercise program. I'm going to give you obviously from the ACE perspective, how to move through this. Now, I will say what ACE wants to make sure you understand is that there's sort of a balancing act here with how much screening testing you should do versus what's really really necessary. And they're going to say right from the get-go, and you'll see this in chapter 5, is that you have to develop rapport, and that's why they were giving you all of this information in the prior chapters. So behavior change, things like that. Now that kind of preps you, and it's probably a good way of looking at it. It kind of preps you now to make some decisions when it comes to their pre-participation screening. Now, remember, ACE is going to move you through sort of the process from start to finish in one sense. The program design, of course, is not the finish line, but they want to get you prepped. They want to get everything perfect for you and your client based on what you and your client have decided. ACE does kind of feel more so now than I have seen them in the past through their other editions. They feel more so that there should be it's sort of like a dance between you and your client. Does your client want to do this testing? Do you want to do the testing? You think it's a good idea? Should you? And I don't think there's necessarily anything wrong with that. Now it's their test. You take their test, you read their book, and you pass their exam. And that's what you want to do. Again, there's nothing necessarily wrong with it. It might be a little bit longer, it might take longer for some trainers than others to get through this entire process. But at least ACE makes a good argument for saying, prior to designing and implementing, I'm on page 137, formal exercise program, you need to develop rapport to determine their individual needs, goals, and interests. Sure, absolutely. Anytime you start working with a new client, it's a really good idea to kind of know them in these different from these different scenarios, their work life, their nutrition, things they're doing that are good, things that are not so good in their life. What are their goals? What are they trying to accomplish? So that's what they're saying, which obviously makes a lot of sense. This information in combination with the client's stated goals and any chosen assessments can then be used to develop a personalized exercise routine based on the guidelines. Do yourself a big favor with ACE. They have a ton of information. Sometimes it can be a little convoluted. They'll go to different places. You got to bring everything back and take it slow when you're reading some of their materials because it does make a lot of sense. So inherent health risk with exercises, obviously read through that. But the real key here is the pre-participation health screening. The most important thing to keep in mind is that what ACE is doing as an NCCA accredited personal training organization is they're using information mainly in this component from the American College of Sports Medicine. And you're probably saying, well, why don't I get the ACSM certification? You don't need to. The American College of Sports Medicine is way more than just a little CPT exam that they give. Okay, American College of Sports Medicine does a lot of research, a lot of stuff done in that organization, and they have come up with some guidelines. And ACE uses those guidelines. Nothing wrong with it. I think figure 5.1 is a good way to go about this. Now, I will say this: figures 5.1 on page 139 and 140 are really good. And if you can memorize them, just get them out of the way right from the get-go, you can handle, 90% of any pre-participation health screening questions. You can get by with 9 out of 10 clients right off the bat just by going through these two. And I'm going to get to that in a second. Now, shift over from a testing perspective. They will ask you a number of questions more than likely from these first few pages. And so it is a good idea to understand why you don't do certain things with your clients from a screening perspective. And that's basically what they're telling you. The ACSM pre-participation guidelines are designed to do what? remove any unnecessary barriers to becoming more physically active. This is a key theme throughout their textbook. Okay. Barriers to exercise. And there are many barriers to people exercising, self-imposed, environmental, external components. And so what they're saying is, let's look at the client, this new person that you've signed up, however that's happened, and let's try to reduce or minimize the barriers, problems, issues related to somebody starting to exercise. Why are you not exercising on a daily basis? Well, there might be some good reasons why. Or I want to exercise on a daily basis. However, there might be some physical, medical, clinical issues that may want, we would say, whoa, slow down a second. Let's not go into this too quickly. Let's get a medical release. And that's really what this is doing for you as the trainer. If you apply this into the real world, this doesn't take very long, just so you know that. But it is important. So becoming more physical. Risk factor profiling or classification is not part of the exercise pre-participation health screening process because supporting evidence is lacking for the presence of risk factors without underlying disease, increasing the risk for activity related. Look, here's what it comes down to is ACE, like most of the other NCCA accredited organizations, and some people still do it, used to have what's known as a risk factor threshold chart. And so you would develop these things called risk factors. And if your risk factor was 1 or 2, whatever the case is, you would do this or do this. Well, what ACE did from their 5th edition to their 6th edition, I think is probably a good idea. So they did a good job with this, is that they basically are telling you, if you have our 5th edition textbook, or you see questions somewhere that talk about risk factor profiling, we no longer do that. Risk factor profiling or classification, right? Go back to their 5th edition. I could show it to you. Is not part of the exercise. We don't do it anymore because supporting evidence, in essence, what they found was risk factor threshold doesn't help it. It doesn't help with anything. It really doesn't. It doesn't help with barriers to exercise. It doesn't help the client because we're already going to do things, basic things, without having to create more, more organizational complexity by having to write things down. That's all they're saying. And I agree, because most of this stuff is just unnecessary anyway. And that's a general statement. But the point is that we don't need to write down that you have a risk factor of 1.5, 2.0. It doesn't, that's just not relevant. If you have a cardiovascular disease, if you have this, if you are displaying or you're presenting with this type of issue, we already know what we're going to do. And that's why this now, the figure 5.1 from the ACSM really takes care of all of this. And so kudos to ACE for doing that. So we don't do risk factor profiling anymore. Lacking for, now they didn't have to write the whole sentence. They could have just said, we don't do risk factor profiling. It doesn't help anybody. So that's what they're saying. So cardiovascular screening must not become a barrier. See, that's kind of the point. I tell you, you got a risk factor threshold of this, and people go, oh, crap. Now what? Well, we want to get people exercising, period. That's it. So again, I think they did a good job. Further, the guidelines note that when an individual becomes more physically active, their risks decline. What are you going to do? Risk factors? No, I'm already training you. I don't care what your risk factors are. We're doing other things to ensure that you are on the road to health and wellness. The new health screening process is based on 3 factors that have been identified as important risk modulators. I love that word, modulators, of exercise-related CV events. There it is. Memorize that. The individual's current level of physical activity. I don't exercise at all. I'm a smoker, drinker. I eat like crap. Okay, that's it. That's one. There it is. Or I work out all the time. I train all the time. Or I just do intermittent stuff, right? The individual's current level of physical activity. Here's the other one. This is key. Diagnosed cardiovascular, metabolic, or renal disease, and or the presence of signs or symptoms. Now, keep this in mind. This is critical from a pre-participation. Somebody walks in, the way we used to do this, I'm talking about decades ago when I first started training people. We use this term apparently healthy. Apparently. I mean, I just saw you driving your car, you pulled into the parking lot, you got out of your car all by yourself, and you walked into the fitness facility. So all of those activities tell me something that you are apparently healthy, which means that on the surface, the ability to do those activities, drive your car, get out of your car, come to the door, open up the door, come in, walk in, maybe get on a treadmill. Those tell me something about that individual. That was enough. That was enough to say, okay, let's start the process of training you. Now, once you scratched below the surface, that's what this is getting to. You either are undiagnosed, you're asymptomatic, but you have heart disease. You're 50 years old, yeah, it hasn't kicked in yet. But even though you walked in and you did all these activities that say apparently you're healthy, it doesn't tell me the true nature of your health condition. On the other hand, you could have walked in and said, yeah, I had a heart attack 5 years ago. My doctor said blah, 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 blah. I just had a screening done, my peripheral artery disease test, my all of this stuff was done, and I got this. Well, that's a diagnosis, or I've got diabetes. I've been diagnosed with. And that's what that second one is saying. Diagnosed CV metabolic or renal disease. Get it? And or the presence of, I don't need a risk factor threshold chart to tell me. If you've got a diagnosed condition, I will immediately do this. That's all it's saying. If you are not physically active, I will immediately go this way with it, with my programming or my assessments. And the third one here is the desired exercise intensity. Screening protocol makes general See, now just remember they're using clinical terminology, protocol, whatever. It's the screening tools that you're going to use, makes general recommendations. Look at the word general recommendations for medical clearance, leaving the specifics. That's the beauty of this. ACE got this dead on, leaving the specifics, such as the need for medical exams, exercise testing, up to the discretion of the healthcare provider. ACE is like hands off on this, folks. Now, I'm not saying I personally agree with this, but the level of skill, the level of education you have as a trainer will determine how much you think is important. Okay, I always run a CV test on a treadmill or step up or something like that. Always, unless the individual physically cannot do it. What ACE is saying is that be careful when you think about doing those things. I've got no issues with that. The goal of the process is to identify individuals who should receive medical clearance before starting exercise, because that's really all we're doing. Hey, yeah, I want to train with you. Okay, you got the money? Yes. You got the time? Yes. Oh, let's train. No, that's not how we do it. You gotta at least go, whoa, whoa, okay, stop. Hold on a second. Let's just make sure that you are either cleared or you are capable of even doing exercises the way I'm going to train you. So who should receive medical clearance before initiating an exercise program or increasing the frequency, intensity, and or volume? With so the goal of this process is identify individuals with clinically significant diseases who may benefit from participating in a medically supervised exercise program. Got to know these three. You also want to know those people that have come in to train with you with medical conditions that may require exclusion. No, you can't train with me. I've only had that happen a couple of times, by the way, where I literally had to tell somebody, I can't train you. I can't train you. You're simply not capable medically. You've got some issues and conditions. Some of them were just because of their physical size. I remember one guy many years ago. He had to have his gallbladder removed. He had developed gallstones and he was obese. And he really wanted to work out. And I was like, here's the deal, is that you're probably going to need to get your gallbladder removed, because that's generally what they do. They remove, if you got gallstones, You don't remove the gallstones. They literally just take your gallbladder out. Yes, you can live without it, of course. Obviously, you can. People do it all the time. The point is that I had to tell him, look, your doctor is saying, why don't you just wait? Let's see about removing your gall. I told him I could not train you. Maybe after the gallbladder was removed, I would. But it doesn't happen very often. But what Ace is saying is that there may be people that need to be excluded from an exercise program until their conditions are resolved or better controlled. And so that leads us then, as you read through this, to this very simple, very basic, really easy to use um, uh, health screening algorithm. And so it's a flow chart. You got two type of people that are going to come in to see you. They don't participate in regular exercise. Go to the next page, and they do. And what is regular exercise? Well, they tell you exercise participation, performing planned. I work out 3 days a week at the gym. That's somebody that participates in regular exercise. Does not participate in regular exercise. See the little one at the upper top right-hand part of the screen. Exercise, perform planned, structured physical activity for at least. Do you do that? No. Then you don't participate in regular exercise. Yeah, but when I come home from work, a couple of days out of the week, I go take a walk. Good for you. Good for you. You should be doing that, by the way. But you ain't exercising. That's not exercise. That's getting some exercise. And many a doctor will tell you, many a fitness professional will tell you, that's awesome. Please do that. That's really good. But now let's get to some exercising, meaning 3+ days per week. Structured exercise that takes you to a certain level of physical output intensity. 3 days per week for at least the past 3 months. So you see the criteria. Don't get that wrong on a question on the test. So those are the type of people that come in. They do participate, they don't participate. And now your algorithm moves from there. You don't participate, whoop, come on over here. Now go through the algorithm. And you've got 3 options. They have no cardiovascular, metabolic, or renal disease, and they don't show any signs of symptoms. So your person comes in, hey, do you work out at all? No. Do you have any cardiovascular, metabolic, or renal issues? No. Do they display any? I don't have any issues that I know of. I'm 30 years old. I just don't exercise. And there you go. So, and no signs or symptoms, suggestive. And ACSM, but ACE shows you any of these conditions at rest or during activity. So it's the sign and symptoms one down here at the bottom of the page that you're looking for. I hope that makes sense. They're fine, good to go. What do we do? Medical clearance is not necessary. So they're giving you a flow chart. So tell me, Joe, do you exercise on a regular basis? Nah, I haven't trained in years. I mean, I used to do college football. I used to exercise in high school. It's been about 5 or 6 years. I need to get back into this. Okay, Joe. Any medical conditions that I need to know about? Cardiovascular, metabolic, like diabetes, or renal disease, right? Kidney issues, anything like that. Ever been? No, I went to the doctor last year. I go every year. He said I should start exercising just right, blah, blah, blah. No blood sugar issues. Okay, so he has none of those. And he looks fine to me. And he tells me he doesn't show any of the symptoms, signs and symptoms. No medical clearance necessary. Light to moderate intensity exercise recommended, may gradually progress to vigorous. You see how this works? Now, again, you see how simple I went through that process. This is what you've got to know when you go through this flow chart or algorithm. The only difference here is that if the individual has a known cardiovascular, metabolic, or renal disease, either they're asymptomatic or they do have symptoms, they both need medical clearance. Anytime anybody says, that's kind of the point here, is anytime anybody says that's not active, yeah, I got diagnosed with stop, cardiovascular, metabolic, renal. Yeah, I had my knee worked on, they had to repair my ACL. That's not a cardiovascular, that's not metabolic, that's not renal. You get what I'm saying? So musculoskeletal issues is not part of this process. I don't need medical clearance on a torn ACL repair. I got to go simply by what he tells me, and perhaps I can get some information from his orthopedic surgeon that says, yeah, he's good to go. Just take it easy. That's normally what we see. So that's that one chart. Any signs or symptoms suggestive of CV, metabolic, renal, regardless of disease status. See, so this is the third type of person. You have a person that doesn't have anything diagnosed and shows no symptoms. On the other hand, you have people that don't show any symptoms, but they do have a known issue. Look, I've trained so many folks with cardiovascular disease from 10 years ago, 15, 5 years ago, 2 years ago. I've trained more diabetics than I can shake a fist at. Uh, these are people that have been diagnosed, but they're asymptomatic, like a diabetic. If they're on insulin, not all of them are on insulin, but if they are insulin dependent, are they taking their insulin? Yada, yada, yada. Everything's good. They're asymptomatic. Blood sugar is controlled. They fit into that middle algorithm, right? Part of the algorithm right there. And then the third one are for folks that don't know. They don't know if they've got the disease status. They don't know if they've never been clinically diagnosed, or they have been clinically diagnosed, but they show signs or symptoms. And there it is. That's the key. They need medical clearance too. And then you'll notice that the two final, once you progress to the actual implementation of your programming, right, they're both going to be the same. Now we do the same thing for participates in regular exercise, and you'll see the three type of people. One is just like somebody that doesn't participate in exercise. They don't have any signs and symptoms, blah, blah, blah. No medical clearance is necessary. Just continue what they're doing, and let's kind of up the game a little bit, perhaps, right? And the other two types now, because they do exercise, you'll notice that the flow chart has the same top components. The only real difference that you're going to see is in this middle one with the individual that has a known clinically diagnosed condition. Medical clearance for moderate intensity exercise, not necessary. Medical clearance within the past, that's all it's doing, is giving you some criteria. Recommended. So medical clearance within the past 12 months, if no change in signs and symptoms, recommended before engaging in vigorous intensity activity. That's all. That's all this is. And of course, if an individual participates in regular exercise and they show any signs of CV, metabolic, renal issues, discontinue exercise, seek medical clearance. It's that simple. Of course, there are other exercise questionnaires, health screening questionnaire for exercise professionals that you can read through, but I just wanted to go through this first part with you. I hope this was helpful. If you had any questions, I'm hoping that this clarified them for you. It's an effective way to begin the process pre-participation screening. Before they even start the exercise program with you, before they start anything with you, you want to make some determinations about whether or not they should seek medical clearance. They don't need to seek medical clearance. You exercise, you don't exercise. See how simple that is? It's like the first question: exercise or don't exercise? Which flow chart do you go through? So if you got any questions, please just leave them in the comment section below. If it was helpful and you understand it, then type the word understand in there. Remember to give us a like, share the video if you wish to. Of course, subscribe if you have not done so. Have a great weekend. We'll see you next week.